welcome to our kitchen and welcome to Cuisinicity. I've been making all these meals all these years for all our kids and my husband and putting it together, nutritious, delicious, good food, good health. But all that had to come from a real expert, and presenting my husband, Dr. David Katz.
Well, I'm glad to contribute something to Cuisinicity, but really, we've been eating well, and it's thanks to you. And what we've said all along is that I'm theory, you're practice. Thanks for practicing it so beautifully. But there is a lot of theory, really, behind good eating and the health benefits. And it begins with good ingredients, and we have a few Cuisinicity Katz family standards right in front of me. But really the first thing to mention is what you don't see here. You don't see anything that glows in the dark. You don't see any highly processed food. You don't see deli meats. And actually, it's a lot of the stuff that makes up the typical American diet that contributes to inflammation, imbalances in hormones, contributes to weight gain and obesity. And all of these things figure in chronic pain. Now, they contribute to chronic disease as well, but just in general, they conspire against health and balance and vitality. And a less vital body is more prone to pain. And with any given source of pain, it's going to feel worse if your body is not well nourished and strong. But in addition to just cultivating vitality, a variety of good foods can confer specific protection against imbalance, inflammation, and basically the mechanisms that lead to chronic pain and that tend to make it worse. So for example, lentils. These are a great protein source, and as such, they're a plant-based alternative to meat. We don't happen to eat red meat. You certainly can have a healthy diet that includes red meat, but if you substitute something like lentils, in particular for fatty meat, you're taking saturated fat out of your diet, and saturated fat is pro-inflammatory. Simply by removing it, you're reducing a source of inflammation in your body. So plant-based protein several times a week is a great way to make your diet an anti-inflammatory treatment, and that can help alleviate not just chronic pain, but one of the key sources of it. Both the lentils and the oats, and of course oatmeal is a terrific breakfast, are also great sources of soluble fiber. And soluble fiber helps to stabilize blood insulin levels. Insulin is a pro-inflammatory hormone. If you dampen down the levels of insulin, that has an anti-inflammatory effect. Now, it's also good for stabilizing weight, controlling appetite. If you prevent weight gain and obesity, that's anti-inflammatory, so a whole array of benefits. Almonds are a terrific source of monounsaturated fat and polyunsaturated fat, and those tend to have the opposite effects of saturated fat, in particular if you get omega-3 fat into the mix. And the walnuts here are a great source of alpha-linolenic acid. That's an omega-3 fat. Now, when we talk about omega-3, you've probably heard the term fish oil, and there is in fact concentrated doses of omega-3 fat in some kinds of fish, like salmon and halibut. That's actually a different omega-3 than you find in plants, but it turns out all omega-3 is good omega-3, and we tend to get too little of it in our diets. In fact, I pretty routinely recommend a supplement for people who aren't eating fatty fish routinely. But if you are vegan and you want to make sure that you're getting omega-3 from plant sources, walnuts are great, flax seeds are great, and omega-3 fat is specifically anti-inflammatory. It actually is a building block inside the body for anti-inflammatory hormones. They're called prostaglandins. And it's not, by the way, that inflammation is all bad, because inflammation is part of our body's defense. We need an inflammatory response to fight infections, for example. But balance is key, and an excess of inflammation will tend to make chronic pain worse. And striking that balance, which food can help you do, will help you alleviate chronic pain or avoid it altogether. And then another way to shut down the pathways to chronic pain is antioxidants, because antioxidants protect our cells from injury. And there are many great sources of antioxidants, and one of the best ways to identify them is bright colors. Not those glow-in-the-dark colors of processed foods, but bright colors direct from nature, like berries, like these strawberries here. Usually those bright colors in fruits and vegetables are from one of two big families of antioxidant nutrients. either carotenoids, and you see those often with vegetables, or bioflavonoids, but both are potent classes of antioxidants. And by soaking up what we call oxygen-free radicals, which is sort of the leftover material from our immune system doing its job in defending us, but you can have friendly fire. Essentially you can have collateral damage to your healthy cells. Antioxidants prevent that. So lots of brightly colored fruits and vegetables. And then the same thing with herbs and spices. And one of the interesting things about spices in particular is that some of them actually have direct anti-inflammatory properties. Curries tend to, and turmeric or curcumin. This actually has figured in Ayurvedic medicine. It's a traditional practice of medicine that uses herbs and spices for antimicrobial properties, meaning that they're sometimes used to treat infection, but specifically anti-inflammatory properties. And turmeric, which of course is a spice that you use in your cooking, is actually used in supplement form specifically to treat inflammation. But make it a part of your diet, and then you're combining the health benefit with the pleasure of good food. And speaking of good food, what's for dinner tonight?
I don't know, but maybe you should kiss the cook.
I'm happy to do that.
So there you have it.